I'm Dr. Demetrio J. Aguila III. I'm a peripheral nerve surgeon, I'm an ear, nose, and throat surgeon, and I'm also a plastic surgeon. I'm the host and founder of the Direct Care Movement podcast, where we dive into the intricacies of direct care, whether it's direct primary care or direct surgical care. You can find out more about what this movement is and where it's going and where it came from. And I am excited to have on board with us today as our guest, Jordan Chadwick from Zion HealthShare. Thank you for joining us today, Jordan.
Thank you for having me.
It's exciting to have you on board. Let's start. Why don't you tell us a little bit about yourself, a little bit about your background, what you do, who you do it for?
Yeah. So I work for it's local to me. I work for a nonprofit based out of Utah. So we're headquartered in St. George, Utah. So nice old sunny St. George. I'm the sales manager over at Zion HealthShare, so I manage all the different types of sales, client relations, things like this. So webinars, conferences, events, expos, things like that. But I get the opportunity to really share what Zion HealthShare is and how it can benefit people, how it's benefited people, and it's a great opportunity. But a little bit about my background is I've done a little bit of sales. I've honestly done a little bit of everything, but I have a really analytical mind, so things where trying to solve problems and trying to help people solve problems comes easier for me. And so I found myself here at Zion HealthShare about 4 years ago, and I've stayed since because it's just a good place to be.
That's awesome. Now, for a lot of our audience, and we talked about this a little bit offline before we started. Our audience is primarily medical students, residents, fellows, people who are recently graduated from training. But obviously, anybody can listen to this podcast. A number of the people in our audience are probably not familiar with a health share. So can you help us understand that? Give us kind of the thumbnail sketch. What is a health share, and where does that fit in the healthcare ecosystem?
Definitely. Yeah, so HealthShare is a little bit newer. It's been around for a little bit. If you've heard of Christian Health Ministries and Samaritan Health Shares, stuff like that. It's been around for a little while, but it is new. It's something that I've come across people not having any understanding of, and that's totally okay. It is different though. So health sharing is a nonprofit model in which members of a community can help share each other's medical expenses. So the perfect example is, let's say I broke my leg and I don't have health insurance. So I go to all my neighbors and I say, can you help me pay this bill? Could you imagine if all your neighbors in your cul-de-sac said, yeah, we're going to chip in this, and all you had to pay was $1,000, $2,500? That would be huge. That's what we do at Zion HealthShare, is we facilitate nationwide sharing in a community of people who are willing to contribute and help each other pay their medical expenses. I like to say we are what insurance should have been. So I'm glad you brought that up, because one of the things I was just about to ask you is, tell us how a health share in general differs from health insurance. Definitely. Yeah. So there are a lot of similarities that you'll notice, and there are a lot of differences. Health sharing differently is we're not networks. Providers don't go and bill a health share. So how we work is our members, our patients, they go in as self-pay patients. Let's just say you did break your leg. You go to the doctor, you say, oh, my leg hurts really bad. They check it out. They're like, yep, we need to get you to the hospital. You need to have surgery. You go to that hospital. All of these situations, you're going to tell them, hey, just send me the bill. I'm a self-pay patient. Send me the bill. The provider will then bill you. And then what you do is you then turn that in. That would be where you go to your neighbors and say, hey, can you help me share this $20,000 bill? Instead, you'll turn it into Zion. What Zion HealthShare will do then is we will then help facilitate the sharing with all of the members so that you get the care you need. One of the biggest differences is insurance has what's called your deductible. That's a yearly thing that you have to pay out of pocket before the insurance company will share into or pay medical bills. We have what's called an IUA. That's your initial unshareable amount. It's the amount you agree to pay before the community will help share in the medical expenses. So like we have 3 levels. We have the 1,000, a 2,500, and a 5,000. The one big difference with this is this IUA is not yearly, so it doesn't reset every year. It is per situation, and everything related to that situation is bundled in one situation. So that broken leg, You went to your doctor, they run x-rays, they send you to a specialist, they send you to the hospital. You may have 2 post-ops. Those are all related to one situation. And so you would pay $1,000 if that's the membership level you select for that whole thing. And then the community will share the remaining cost up to 100%.
That's awesome. Now, in an insurance model, the company, let's say ABC Insurance, because I'm not going to name any insurance companies. Hopefully there's not an ABC Insurance out there, right?
I don't think there is.
If there is, I'm not targeting you specifically, right? But ABC Insurance, the company is responsible to its shareholders. Who is Zion responsible to?
So Zion's responsible to the members. The members always come first. That's the beauty of being a nonprofit. And when you do contribute to the community, you're not contributing, and no offense to insurance companies, but you're not contributing to pay an insurance company. You're contributing to share in other people's expenses and save people's lives, to be honest. So how that works for us is we can only take 10% off the top. The remaining 90% will always stay with the members. So Zion Health Share is always member facing. Everything we do, everything that happens here is about the members and is always about what's best for our members and what's best for the community of members in whom we serve.
That's so amazing. So, okay. So, if Zion is responsible to the members, then there's a certain level of responsibility that the members have to Zion, effectively to the other members, right? How does that work? How does that play out, this responsibility that each of the participants has to each other?
Exactly. So one of the biggest things, especially in America, is that's causing healthcare costs to go up and increase is taking care of ourselves. One of the biggest things we ask all of our members to do is we have what's called member guidelines. These member guidelines have some attests at the beginning, basically that you're just going to take care of yourself, that you're going to be healthy, you're going to take care of others, you're not going to participate in abuse of any form, things like that. The more you take care of yourself, the better that is for the world, the community, yourself. And when you're healthy, it allows people to get the sharing they need when they need it the most. Not saying you can't be unhealthy and come on. Definitely, we're not going to exclude anyone for if they come on and they just have conditions. But we do have guidelines in place to really help facilitate that sharing and help prevent abuse of the system so that when someone truly who's done everything they can to be healthy has an emergency, has an accident, the community can step up and share into the costs.
Awesome. Now, historically, insurance, we'll step outside the healthcare model for just a moment here. When we think about car insurance or homeowners insurance or whatever other kind of insurance other than health insurance, historically, insurance was intended to cover things which met 2 criteria. They had to be catastrophically expensive and unexpected, right? So, God forbid a tree falls on my car right now. I don't want that to happen, but let's say if it did, my insurance would cover that, right? Or if my house got struck by lightning, my insurance would cover that. But, if I want to repaint the house, well, my insurance doesn't cover that. Or if my car needs an oil change or needs new wiper blades, the insurance doesn't cover that because that's not unexpected and it's not catastrophically expensive. But in recent years, health insurance has evolved to effectively cover the equivalent of an oil change, right? And which obviously adds a whole bunch of extra costs because now you're paying somebody else to then pay for the oil change. And that somebody else has bills to pay. They got, a roof to keep over their head. They got to put food on their plates and clothes on their back. How does Zion and how do health shares in general and Zion in particular thread that needle?
Yeah. The biggest thing I would say is education. It's coming to the understanding of that problem, that situation that's going on. Is America, we're so used to, as Americans, no matter who we are, where we come from, if we live here, we're just so used to paying people to do stuff for us. One way that I've always helped people get through that, because Zion Health Share, we are for the big stuff. We're for the stuff that's going to exceed that initial unshareable amount. We're for that catastrophic, the broken legs, the cancers, the maternities, the surgeries, those big scary bills of, oh, I don't have insurance. What's going to happen if I got sick? What's going to happen if I get appendicitis? Then you're hit with a huge bill. That's what we're here for. But that day-to-day stuff it's essential to understand that, and nothing wrong with the insurance world. Like I love the benefits I use. But if we understand that those things are actually not that expensive, they're not that expensive. And the scary thing is that's much better to be self-pay for that than it is to be self-pay and have no benefit at all and you get in an accident. It's a lot cheaper. That day-to-day, the routine, that oil change for a car is a lot cheaper than the car insurance that we're paying for. And so not saying don't get that car insurance, because that's, like you said, historically, that's what insurance should be, is it should be for the big stuff. And then that routine day-to-day. Now at Zion Healthshare, one thing we do have is we do have some assistance for those day-to-day things. We have what's called our preventive sharing. And then also you can bundle us with a lot of different things such as direct primary care or different things. Direct primary care basically is the model of Zion. It's like what Zion Healthshare does for the catastrophic, but it's for your day-to-day. And it's pretty awesome. It's a lot cheaper too. It saves a lot of money. But our preventive sharing, it gives you yearly office visits, gives you screening mammograms, screening colonoscopies, and those youth immunizations and well child, well baby visits. We help share in the cost of those without you having to pay your IUA. That is an add-on that you can give onto our memberships. And I know other health shares do similar things to assist in that day-to-day. But the biggest is just coming to the understanding of how actually inexpensive those day-to-day things can be if you do it right. And if you have the understanding of how do I work this healthcare system rather than letting the healthcare system work me.
Well, I'm glad you brought that up, because you kind of hinted at this earlier. When you go into the hospital or wherever, as a patient, and you say, okay, I want you to understand I'm self-pay. What's the importance, apart from being honest, right? Because I'm a member of Zion, which is partly how you and I got connected. And we'll dive into that a little bit more in a minute here, but I go in and I tell them I'm uninsured, which is true, right? Because I don't have health insurance. So apart from the fact that I'm being honest by saying, okay, this is self-pay, what are the other benefits that benefit not just me as a patient, but the rest of the community, the Zion community, by me going in and saying, okay, I'm self-pay?
Yeah, definitely. So when I first started at Zion Healthshare, I learned this very thing majorly. So at first, I always thought like, oh yeah, insurance, you get your network repricing, you get these better rates. That's incorrect. The best rate that you can get is the self-pay discount. When you go in and you say, hey, I'm a self-pay patient, what happens? Provider's like, oh, instead of billing you $10,000, what if I just charge you $6,000? And so usually we've noticed at Zion Healthshare through experience, we used to have a network that the self-pay discounted rates are the best rates you can get. They're so much better than any negotiated rates that an insurance provider might have. And so going in as self-pay automatically gets you discounts, and that saves the community. That makes it to where you can go to any provider. We don't care who you go to. But the hardest thing that I've learned at the beginning, so I worked with a lady who she was going in to just get a regular mammogram. She wanted to get a mammogram. They were going to self-pay charge her $200. That she goes to them and is like, oh yeah, I have the Zion insurance. That's incorrect. We're not insurance. That the provider comes to us and says, nope, I'm billing you $1,400. That's one of the biggest things that I learned while working here is that, and no offense to the providers, but that's just what they charge. And insurance gets charged up to 5 times or more than what a self-paid patient is. So that having that knowledge, having that understanding of this is why we sent you in this self-pay, is because that's what's allowing us to say, we don't care who you go to, as long as you go to someone who will accept you as self-pay.
And that's, I can't say enough about that. That one piece of information is so valuable. When I still had health insurance, I think it was about 7 years ago, maybe 8 years ago, I needed a shoulder MRI. And at the time, I was working for the hospital where I got the MRI done. And that MRI was $5,000, and my insurance covered $1,500 of it. And I was really grateful that I had such good insurance that covered the $1,500 of my $5,000 MRI. And then I found out from a patient of mine a few weeks later that he got the exact same MRI as a self-pay patient for $485. Yep. $485 wasn't, his portion and the insurance covered the rest. $485 was the total amount. And I got to pay $3,500 for the privilege of using my insurance.
Exactly. It's really interesting. I always think about that, like that 485, that's how much the doctor, and they're still benefiting. They're not losing money. The hospital's not losing money. The doctor's not losing money. And so it always just baffles me why they charge an insurance company so much more. And you're right, it's split between the insurance and you. So you paid $35, but that insurance also paid $1,500. That's why insurance rates spike, is because of how much they're being billed.
Exactly. And, sometimes it just boggles my mind. So then, okay, so I want to kind of change gears just a little bit here. So, we talked about a little bit about how insurance and health shares are different and how Zion is different in particular. What's the benefit to the doctor? Okay, again, keeping in mind who our audience is, what's the benefit to the doctor of encouraging patients, whether it's a primary care doctor or a direct specialty care doctor, saying to the patients, hey, listen, you know what? You might want to consider a health share like Zion instead of your conventional insurance model.
That's a really good question. I would like to say that there's a lot of benefits. One, do you want to get paid? Because I know as a doctor, you'd want to get paid. I would think so. And so insurance, you have hassles of when do I get paid? When are we going to get all this money? That might be why, as a doctor, they charge insurances so much.
Right. Or do I get paid? That's another big
or
question.
Will you ever get paid? Like, what if that insurance denies it and then that person goes bankrupt? How do you get your money? By encouraging people to go to Zion Health Share and presenting as self-pay, either the member is going to pay you or we're going to pay you. Like, just like if you were to truly have like, hey, I just fixed someone's appendix, got it removed, and now I'm like, oh, how are they going to pay me? They're self-pay. Well, knowing what Zion Health Share is and saying, hey, go check out, you've referred these patients to Zion Health Share. Oh, you have your Zion Health Share membership. Hey, you pay $1,000, the community will share the rest. We have never had a situation where we didn't pay a provider, where we just said, nah, we're not going to pay. We've never done that. We've always paid, as long as, of course, the member pays their responsibility, then we can pay ours. And that responsibility is so much lower. I would rather pay $1,000 through Zion Health Share than pay my $6,000 deductible. And so it's just by telling the patients to use their Zion Health Share memberships, you are 10 times more likely, in my opinion, to get your money, to get it quickly. Oh man, so my wife had a baby, and she got the epidural. 9 months after the baby was born, they finally sent us the bill for the epidural. And so I feel how the providers feel, because I got that and I'm like, this is $2,000. I have to pay this out of pocket right now. So I just sent it in Design. They're like, you're good. We got you. They paid all of it because I already paid the IUA for that entire maternity. And so they paid it immediately. They paid it overnight. And I'm sure that provider was like, whoa, that was fast. But I would say that's one of the biggest benefits, is just how you get paid, when you get paid, just that you get paid. And then your members are a lot happier too. Like, I would feel, to doctors and to us at Zion Health Share, we're all about our patients and our members. Everything we're responsible to are these members, these people we're treating and taking care of. Let's make that experience better for them on all sides of it. Yeah, let's provide excellent medical care, but let's also make that more financially easy for them, so that they don't feel the stress and they aren't coming back because they popped all their stitches because they're stressed out about how do I pay my bills.
Yeah. So this all sounds awesome, right? From a patient perspective. And I can imagine, there are a lot of doctors out there that are listening right now are saying, okay, well, this sounds really good for the patient, and it sounds really good for me as a doctor. I get paid reliably, I get paid a reasonable amount, etc. But I can imagine there's a bunch of people who are listening who are thinking to themselves, wow, well, then this must be horribly, horribly expensive. I mean, I just read the other day that the average annual premium for a family of four for health insurance is $25,000, a little bit over that. And then the average annual deductible is $7,500. So what does that work out to? That's just over $30,000 that family has to pay out of pocket before the insurance company covers anything. And they don't provide the convenience and the level of help that you're describing that Zion does. So, oh my goodness, Zion must be, instead of $30,000, maybe $100,000 a year. So let's talk about that.
Definitely. Well, instead of $30,000, it's maybe $400 a month. So like $4,800 a year. So how we work, and people always ask, they're like, this is too good to be true. This is awesome. I then share the price. Yeah, your average family's $380. And they're like, that's not right. Something's wrong. How is that possible? We're nonprofit. We can only take 10% off the top. We can't take any more ever. So whatever stays with the community forever. And this is why we have guidelines. This is why we ask people to take care of themselves, to be educated, to understand how to work the healthcare system so that it doesn't abuse them. And that's because that saves us money. When members go in as self-pay, that saves the community money, allowing us to do more for people, allowing us to keep our rates lower. You are correct, like $2,500. And if you get that through an employer, you're still having to pay at least 50% of that. And so that's huge. That's $20,000 to $30,000 every year before anything happens. Or you can pay $5,000 a year, maybe between 5 and 7, get the care you need when you need it. As well as I like to say, you go home feeling good. When I pay my insurance company, half that money probably goes to pay their executives, send them on trips, do whatever they want to do with it. But when I pay Zion, I know, hey, that money is actually going to help somebody. And what's really cool is we're building a system to where you can see that. You can see, oh my goodness, $500 that I've contributed has gone to help this person who had cancer. How would that make you feel? That makes me feel awesome.
For sure.
So it's
Absolutely.
Education. Education is everything. Understanding that there are better options. And you don't have to be expensive. It doesn't have to be $2,000 to get the care you need. It can be $400.
Awesome. So let's dig into something a little bit more that, physicians would be more familiar with. I'm sure there are a lot of people who are listening who are going to really resonate with what I'm about to say. When I used to work with insurance, whether it was one of the government programs or whether it was one of the private programs, I often felt like when the insurance company would pay, they determined what they were going to pay, when they were going to pay, and if they were going to pay by throwing a dart at a dartboard. Like, oh, yep, that's the number and that's the date, and and we're going to pay this amount, regardless of what the bill actually was, right? And we would often get answers like, oh, well, that's not medically necessary, or a whole bunch of other excuses. How does Zion determine who gets paid and who doesn't? Or what diagnoses get paid and which ones don't?
Definitely. So we do have member guidelines. So there are certain things that just aren't shareable. For example, you're in professional sports, you get injured, we can't help you. You engage in illegal activities and get injured because of it, we also can't help you with that. So there are certain restrictions and limitations to what Zion Health Share can help in. And I think it's essential to also understand that so that you can understand, is this truly going to be the best fit for me? Do I engage in professional sports and I need something to pay for those bills? Then this isn't going to be what's best. So we do have what's called our member guidelines. These are on our website. They're updated quarterly, sometimes yearly, but at least once a year. It's live. So check out our guidelines. Go to zionhealthshare.org, go to the resources tab, and then go to the member guidelines. And you can see a list of different things. The biggest thing I like to share is pre-membership medical conditions. So this is where a lot of people will get held up. They're like, well, what happens if I come in with a condition? So we have a guideline where we look back in the 24 months prior to your start date, and if you have a symptom, if you had a medical treatment, a diagnosis, you've taken medications, in that 24 months, so like I had knee pain for the last 12 months, and then I signed up for Zion Health Share, that's going to be deemed pre-membership. The biggest thing to know is that does not mean that you can't get sharing. That just means there's a 1 year waiting period before the community can start to share. And that teaches people to not hop on, get $1 million sharing, and then hop off and they've only paid $385. That would be detrimental to the community. So we do have guidelines like that of what we can share. And that is the number one reason something's denied. As a provider, your worry would be, what if I don't get paid? What if they don't want to pay it? Well, was that member pre-membership? Then yeah, we can't pay that in the first year. We can pay it, however, in the second, third, fourth, fifth years beyond.
That's awesome. One of the things I love about Zion in particular, and I've found this to be pretty much true across health shares in general, but especially with Zion, unlike with health insurance where, there's a whole bunch of little itty bitty fine print and they throw all these hidden rules at you about, oh, well, we're not going to cover that because of this, or we're not going to cover this because of that. With Zion, and correct me if I'm wrong in my understanding about this, but this has been my experience. Basically, there's a comparatively short list of things that don't get shared, which is all very transparent and right on the website and right in all of your materials. And basically, if I understand it, the attitude is, well, if it's not on that list, then we got you.
Exactly. Yeah. We have a list of what is ineligible for sharing. And if it's not on there, yeah, you're correct. There is a section that says eligible for sharing, just to know that is just limited. So those are not a list of extensively, this is what we're going to share into, and this is what we're not. That's a list of these things have conditions. We'll share into them, but on condition, like therapeutic treatments, we have limits on how much we can and how long. But then that extensive list of not eligible, if you don't find it on either of those lists, guess what? We'll share into it. There's no reason why we wouldn't. And such things as you're not going to necessarily find cancer on one of those lists. And so people might be like, what if I get cancer? What if I get breast cancer? Guess what? We'll share into it. The community will share as long as it wasn't pre-membership and you're in your first year.
So I want to dig into another side of this that I think probably a broader, or maybe not broader, but a different swath of our listening community will really appreciate. So in addition to being a physician and in addition to being a patient, I'm also a business owner. And I think about the people that work for me, the people that work with me. I guess the IRS thinks of them as employees, but they're my team. And I want to take care of my whole team. And, health benefits were originally conceived of as a retention tool to try to, number one, encourage people to recruit and come to the company. And then two, to encourage them to stay, right? But health insurance is really, really expensive. I mean, we start talking about annual premiums and then the deductibles like we were talking about earlier. That's a lot of money. But one of the things that I found was that Zion has a great program for employers who want to offer this as kind of a group plan for the employees. And, just to front load this, I think for my entire company, and I cover all of it, because I know there's a bunch of different ways you could do that. I can cover a portion of it. I can cover all of it, but I cover all of the monthly cost. I think it's for about $1,600 a month for the entire company, for the whole company. And that's, that's multiple families. Can you dive into that a little bit more, how this works for employers? Because I think there's probably a bunch of physicians out there who either are part of a company that's trying to figure out how to save some money and take good care of their people, or somebody who's thinking about starting up his own company and saying, oh, how can I do this? How can I take good care of my people and still feel good about, what we're doing?
Exactly. Yeah. And you're correct. We have a perfect program for our companies. That's what I work a lot with. I work a lot with employers and big businesses, small businesses. The beautiful thing about this is it's a one-stop shop. So what happens is if you bring on your 10 employees and you say, hey, we're going to sign up for Zion Health Share, they get to pick what membership level they want. Of course, they can put dependents as many as they want on there as well. They get to pick. It's up to them. You don't have to say, oh, sorry, you can only do the 5,000. You can only do the 1,000. They can pick and choose. We will then bill the company the flat out fee, like you said, $1,600 for all 10 of your employees. At that point, you then can figure out, how do I want to payroll deduct this? It is post-tax, but you can pay for all of it. That's actually an awesome thing that I see from a lot of companies like yourself, is the willingness to say, look, I'm saving hundreds of thousands of dollars probably if I'm going to provide some standard benefit with an insurance company who's going to charge me $1,500 and then them $1,500. And so for us, it's like $400. You pay all $400. You as the company are saving a ton of money. And then that member, oh, they're never going to leave. Why would they? Hey, I got you 100%. All you have to do is pay your IUA if something arises. That's awesome. That's a fantastic benefit. And that's how I think it should be, is it should be accessible like that, to where through an employer you might have that. Or worst case scenario, maybe the employer's splitting 70-30 or 50-50. You pay only $200 of the 400. That's still huge. That's awesome. That's saving a lot of people money, and that's helping a lot of people.
Yeah. And in our practice, I mean, as a direct care surgeon, I can't just talk the talk. I have to walk the walk, right? If I'm going to tell people direct care is the way to go, I can't then turn around and say, oh, by the way, I don't want you to use insurance, but I do, right? If I'm going to say health shares are a big part of this puzzle, a big part of the solution, well, then I got to show that I actually believe it. I got to put my money where my mouth is. And I will tell you, and I'll tell everybody that's listening, every day and twice on Sundays, that has definitely been the case. My family and I have been on health shares for the last 7 years since we opened up the practice. Actually, since before we opened up the practice. When shortly after I joined the Free Market Medical Association and found out about health shares, I was like, okay, we're going to do this now. And we never looked back. We have never once regretted the decision to switch to a health share. And it's something that, I like to think of myself as a health share evangelist. I want everybody to know about how awesome this is. And I talk to all kinds of people about it. And I figured this is a great platform for us to do that. So with that in mind, I want to dig into, and I got my wife's permission to have this discussion. So I want to dig into this from a patient perspective and from a family member perspective. So for many of you out there, you may not be aware that my wife was recently diagnosed with cancer. And of course, up until this point, we had not had any really big healthcare expenses, since we switched to health shares. And we were nervous, we were very nervous. We're like, okay, this is the story that we've been told. We've heard other people's stories, but how's that going to affect us? I mean, was this a whole bunch of marketing, BS? And now we're going to get stuck with this gigantic bill, or how is this going to work out? And so we got home from the emergency room actually she had been admitted initially, and they made the first diagnosis, or they made the diagnosis initially. And we were terrified, and we called up, there's a number for Zion. And so we called and we explained the situation, because that's what we were told to do. When you have an expense, you call up and you make this, you tell them what's going on. And so we did. And we said, okay, this all happened. What are we going to do? Number one, I want to say how much my wife in particular, because she's the one that had all these conversations, how much she loved having the conversation with each of the people there at Zion. Because the person that answered the phone and answered her questions, and the person that answered the phone was the person answering the questions. It wasn't, I'll forward you to this person, I'll forward you to that person, I'll forward you to that person, talk to this computer. It was very personalized and very kind. She was patient. She was informative, and she said, don't worry about it. We understand this is very stressful. Send us everything you have. And we'll look at it and we'll get back to you. well, we don't have any bills yet. We don't know where we're going to get the bills. Don't worry about it. Just send us what you have. If you have the doctor's notes, that's really helpful. And so we uploaded the doctor's notes that morning. And I think it was about 4 hours later, my wife got the phone call from that same lady. You know, she had been assigned to my wife's case. And she said, we looked at the doctor's notes. We looked at his entire plan of care. Every single thing on that plan, approved. Not, this is a prior authorization. This is not a guarantee of payment. None of those little caveats. My wife started to cry, and she's like, "What? You've approved it? Okay, tell me again what that means." And she said, "No, we approved it." And of course, my wife, I don't remember her exact words, but her response was something like, "We were really nervous that you guys were going to screw us, like how insurance companies have done to us in the past." And I don't remember the exact words, but it was something like, "No, we gave you our word. We're just making good on that." And I think to date, my wife's still undergoing treatment. To date, she's accumulated over $500,000 in self-pay bills. Okay. I mean, who knows what that would look like if they were actually insurance rates, right? So over $500,000 in self-pay bills. Have we run into any obstacles, any situations in which Zion said, "Nope, we're not covering that"? Have we run into any of that? Not once. Not once has anybody said to us, "Sorry, you're on your own." And, what's it like on your end when somebody like me or somebody like my wife comes along and says, "Oh my goodness, I have this disastrous diagnosis. It was unexpected. It wasn't one of these pre-existing conditions." I mean, I imagine, people there at Zion have people crying on the phone all the time with situations like this.
Yeah,
what's
we
that
have
like
a lot of stories. Yeah, from my side and from our side as a general Zion Health Share, it's actually really touching. Like, it's really cool when people like yourself, like your wife, have those experiences, because then we're like, wow, it's working. It works. And on our end, there's no obstacles either. We're not sitting here like, should we share that? Not at all. It meets the guidelines. We're like, we want to help. This is what these members have signed up for. Our members signed up to help you. So let us help you. And it's really tender. It's really touching when you have situations like that where people are like, "You paid $500,000 for me to date, and we've had no issues, and you'll likely have more bills, and we will pay those." Like, that's real. Those are really cool stories, and there's a lot of them. You're not the only one. There was a COVID bill that was $2.7 million, and the member only paid their IUA. And so we can help people, and we do. We help people in the way that I like to say insurance should have. But it's really cool, and it's really easy. It's not hard on our end, and it shouldn't be hard on your end. And like you said, we have like 50 people who just answered phone calls just to help you process sharing. So we can be personal. We can be your friends and your advocates.
Well, for my part, on behalf of my wife, on behalf of my family, on behalf of my company, I'm so thankful just to be able to have this conversation with you, and to be able to say thank you to everybody at Zion through you and through this podcast. Even if nobody else ever listens to this episode, for me personally, it will have been worthwhile for me to express to you just how awesome Zion has been for me and my family, and what a huge contrast that has been to our experience with numerous health insurance companies as patients on the receiving end of this, not to mention, the difference in interactions that I've had as a physician. And so from the bottom of my heart, words cannot adequately express just how awesome this experience has been, not just from a financial standpoint, but from a mental standpoint, an emotional standpoint, from a spiritual standpoint, just knowing that we've had the support of not just you and not just the person that's assigned to my wife's case, but from everybody in the whole Zion community. It's been such a huge blessing. And I just wanted to say thank you.
And we thank you. You're the ones, it's the members who make this possible. It's the people in this community who contribute day after day, month after month, who help and who unawareingly help people. That's what makes this all possible. That's what makes the magic happen, is people who commit and who gain an understanding and who come and join. And then, of course, we'll take care of you too. So yeah, you get to help people and you get helped.
Awesome.
It's the way people should be.
Awesome. So as we tie up here, do you have any last thoughts or words of wisdom for our physicians in training and for our medical students and for our new physicians or anybody else, any other physicians that are listening?
Yeah, I would say the biggest advice I have is education. Understanding that we're not stuck and confined to insurance. It has its place. I don't want anyone to ever feel like I'm ragging on insurance. Insurance has its times, it has its place in which it is beneficial. And if that's what you need, get what you need. But having the education to realize you don't necessarily always need that just because an insurance company says, oh, you need us. Well, do I need auto insurance? Probably not. I've never had a car accident and it's never going to pay my oil changes, but I still have it. Of course I have to, but there are options out there like health sharing, and it saves time, heartaches, money. I'm sure we have not only blessed you with being able to pay those bills, but we've blessed you emotionally, and we've done that with many people. We can make your lives easier. So I would say my biggest advice to any physician and any member out there is having the understanding that there are better things. The world is not confined to a status quo. It's not confined to one way of thinking. We have alternatives, and we can save you everything: money, emotionally, time. So learn about us. Teach your patients about us. Spend the little time it takes. Call us up. Call my team up. We will gladly walk anyone through how this works. If you want to set up as a company, or if you even want to just refer people, we got you. We'll take care of you.
Awesome. So that brings me to my final question. How do people find you?
Yep. So people find us a lot through our website, of course, zionhealthshare.org, or you can call us up 888-920-9466. But we're really working on some marketing, so you might see more of us coming out there. But reach out to us anytime. You can shoot us emails. Our emails are on our website. You can schedule meetings with us. We have links on our website. That's how people find us mostly right now, is it's word of mouth. It's podcasts like this where people can share their own personal experiences with their friends. That's what brings people to the community of Zion Health Share right now. So even if this isn't a good fit for whoever's listening, you will find people that it will be. As a doctor, I 100% can guarantee you will find people who this would be a huge option for them. So share it. Share experiences that you've heard. And it will only help the community. It will only help them.
Well, thank you, Jordan, so much for joining us on the podcast today. It was really exciting having you on board. I just can't say enough thank yous to all of you there at Zion. If those of you who are listening want to learn more about Zion, please, check our show notes, because all the contact information that Jordan just shared with us are in the show notes. So make sure you take a look at that. Thank you for joining us on the Direct Care Movement podcast. We're excited that you joined us, and we're looking forward to having you join us in future episodes as we dive into more questions and more concerns and more solutions in the direct care space, whether it's direct primary care or direct specialty care. If you liked what you heard and you want to know more, please click like and subscribe and leave us a review. And don't be afraid to reach out to us directly so we can get you more information about direct care, whether it's direct primary care or direct specialty care.